Imagine driving a car for 40 years without ever changing the oil or checking the fuel lines. That is exactly what most of us do to our pancreas, the body's most underrated engine room. It handles every gram of sugar you eat and every calorie you burn. Yet we treat it like it invincible. Today we are opening the hood to show you why your engine is stealing and how to give it a second life. Anatomy of Unsung Hero. Welcome to a deep dive into body's most underrated organ, the pancreas. Nestled deep within your abdomen, hidden behind your stomach. This 6-inch pear-shaped gland is your body central processing unit for fuel. It isn't just an organ, it's a dual purpose factory that dedicate your daily energy, your long-term cellular health, and ultimately your longevity. The dual engine matrix. The pancreas operate two distinct engines simultaneously. The exocrine engine handles digestion, deploying enzyme like amylase, lipase into the small intestine to break down fat and carbs. The endocrine engine regulate energy, releasing hormone like insulin, glucagon directly into your bloodstream to manage sugar. When these engines fails, we face everything from malnutrition to type 2 diabetes. The energy fulcrum, beta and alpha cells. Think of your blood sugar as a seesaw. After a meal, glucose spike triggers beta cells to release insulin so your cell can absorb fuels. Between meals, when sugar drops, alpha cell release glucagon, promoting the liver to release stored energy. This loop fires thousands of times a day. If these cells are exhausted, the seesaw breaks. The pancreatic thread spectrum. There are the three primary ways the system fails. First one, type 1 diabetes, an autoimmune attack where the immune system permanently destroy beta cell. Second one, type 2 diabetes, metabolic overload leading to insulin resistance and beta cell exhaustion. Type 3, pancreatitis, painful inflammation often caused by gallstone or alcohol leading to organ autodigestion. The anatomy of beta cell burnout. The road to diagnosis is often silent. In phase 1, the body overproduces insulin to fight resistance. In phase 2, the system crashes as production fails. By the time a patient sees an abnormal A1C number, in phase 3, their beta cell have already been falling a silent year-long stress test. The cascade of pancreatic failure. Our modern environment present two major cascades of distraction. The fructose threat. Refined sugar and sodas cause rapid fat creation, leading to ectopic fat accumulation in the liver and pancreas. The saturated fat threat. High animal fat stimulate excessive hormone release, creating lipotoxicity that destroy cell function. The silent alarm, recognizing distress. Pancreatic issues are historically hard to detect early. We must watch for warning dashboard. Sudden onset diabetes without typical risk factor. Jaundice, yellowing of eyes, skin, coca-colored urine or beige stools. Unexplained weight loss and severe back or abdominal pain. The regenerative frontier. While we manage symptoms today, the future is in regenerative medicine. Scientists are now sourcing skin cells, reprogramming them into stem cells, and growing 3D pancreatic organoids. Using pathway like the USP7 enzyme, we are learning to grow fully functional insulin producing beta cell in the lab. The synthesis, one organ, one shield. Here is the core insight. The threat to your digestion and your blood sugar are identical. Alcohol, refined sugar, and stress trigger an undefined cascade of inflammation. However, a single unfilled protocol focused on the plant, sleep, and movement can protect the entire organ at once. To expand on defensive shield, we must look at how these lifestyle choices act as a mechanical intervention for your pancreatic health. Whole food plant predominant diet. A diet centered on the plant is the primary tool for reducing ectopic fat that settle directly inside the pancreas and the liver. Physical exercise. Exercise serve as a metabolic sink for your body. Circadian rhythm and restorative sleep. Sleep is designated period for cellular maintenance. Deep sleep cycle trigger the repair mechanism necessary to heal the engine room from the oxidative stress of the day. Stress management. Severe emotional stress is not just a feeling, it is a biochemical threat to the pancreas. Avoidance of toxins. Eliminating alcohol and tobacco remove the most potent external trigger for DNA damage. Social connection. While often overlooked, social health impact biological recovery. Positive social interaction improve the body ability to recover from metabolic insult and maintaining long-term adherence to healthy protocol. Fueling the engine, biochemical nutrition. Your engine needs premium fuel. Phytates from bean block tumor blood flow, and the fiber lowers inflammation. Conversely, contaminated fuels like well done meats or ultra processed food containing carcinogens like nitrosomanins that specifically target the pancreas. Metabolic rest and fluid dynamics. Think of intermittent fasting as a pressure valve. It gives pancreas downtime, allowing beta cells to recover from demand of insulin. Similarly, hydration is your fluid gauge. Proper hydration prevents enzyme stagnation and modulates the inflammatory response, reducing the risk of acute flare ups. Cooling the system, movement and mind. Your brain and muscle are powerful allies. Mindfulness, altered brain structures to lower cortisol, which otherwise fuels the tumor growth. Resistance training, create a glucose sink pulling sugar out of the blood independently of insulin, radically reducing the daily workload on your beta cell. True metabolic restoration. The reality is that we cannot yet grow new beta cell to replace those lost to chronic disease. However, you have total control over environment in which your remaining cell operate. By adopting this protocol, you can halt the cascade of inflammation. Conclusion. You may not be able to replace your metabolic engine, but you can give the one you have second life. Protect your pancreas through your daily choices, and it will protect your health for years to come.